Hey, it's Dr. Noseworthy. We're back with part 2 of our thyroid series, and today we're going to focus on the autoimmune aspect of Hashimoto's disease. Now, if you remember from the end of our first session where we talked about the thyroid system in the big picture and then showed you how the system works from the brain down to the cells, we said at the very end that statistics tell us that almost all thyroid conditions are autoimmune. The statistic is 90%. And that includes both high and low thyroid disorders. So, for example, Graves' disease, which is autoimmune hyper or high thyroid function, is an autoimmunity, as is Hashimoto's disease, which is autoimmune hypothyroidism. But when we look at the prevalence of each one, we see far more clients with Hashimoto's disease than with Graves' disease. And the statistics vary from year to year and, of course, source to source. But some estimates are as much as for every one case of Graves, you're going to find dozens, if not a couple of hundred cases of Hashimoto's disease. So having said that, that is going to be our focus of our talk today, is the Hashimoto's variant of autoimmune thyroid disorders. But let me make this one comment before we get into Hashimoto's and autoimmunity. When we look at the natural approach to managing autoimmune issues, the target of that being the thyroid, or for example, cartilage in rheumatoid arthritis, or even brain tissue in something like multiple sclerosis. The tissue that's being targeted and attacked by the immune system is really not the clinical focal point. And that's going to be the final thing we talk about today. Like, what is the focus when there is an autoimmunity? And it doesn't mean that you don't support the target tissue. So, for example, we may do some things nutritionally to support someone's thyroid gland, but really the biggest game to play is working on the immune system. But before we get to that conclusion, I want to build a little bit of understanding, at least at a fundamental level, of autoimmunity in that process. And then we'll apply that to the thyroid just to make sure that you have the fundamentals that you need to understand what's going on. So what we're going to cover today is we're going to talk about the basics of autoimmunity. We're going to talk about how there's a 3-stage progression with autoimmune disease. We'll talk about specifically how Hashimoto's targets the thyroid, and then we'll talk about the clinical focus, and we'll use that as a jumping off point for the next session, which will actually go into what is the framework as of right now, what we know in medical science, how are we managing autoimmune issues. So let's talk about the basics. Let's define this concept of autoimmunity. First of all, in the world of immunology, there's a concept called self-tolerance. And that basically means that my immune system should know the difference between what's me and what's not me. And it should be able to recognize my tissue versus a bacteria and decide to leave me alone and go kill the bacteria or a virus or a parasite or something else. And so self-tolerance is that ability to distinguish self from non-self and then have an appropriate response. And when we lose self-tolerance, when the immune system becomes confused, for lack of a better term, about who is me and who is not me, then it can start to attack me in a way that is completely inappropriate. So it looks at a bacteria, it looks at a virus, it looks at a chemical that's come in from the environment, and then it looks at me and goes, you kind of look like those other guys, let me go and attack and destroy you. That, of course, would be inappropriate. Now, with autoimmunity, there are a couple of fundamentals, and this is kind of the downside of a discussion like this, is that right now we don't know how to cure autoimmune disease. There's no drug that does it. There's no miracle supplement that does that. There's no miracle energetic technique that does that. We just don't know how to do it. Now, hopefully that will change. But we do understand that for most people, autoimmunity is permanent and it's progressive. We have an expectation that if you have an autoimmune disease today, then if you're not doing very specific things to take control of your immune balance and to get rid of things that are driving your immune system to be more aggressive, then your autoimmunity will continue to get worse at a more rapid pace. Now, we generally accept that autoimmunity does progress. The question is, how fast are you going to let that happen? Are you going to control things as best as you can so that you get minimal progression over long periods of time? Or are you not going to control things that are under your control and end up with a lot of progression in a very short period of time, or a lot of progression over long periods? So we know autoimmunity to be this loss of self-tolerance. Your immune system loses the ability to distinguish between what's you and what's not you, and that is a permanent process. Research says that there's a huge genetic component here that's probably the biggest picture with related to where this stuff gets started. It is progressive, but it is manageable. And that's the thing that I want you to hang on to. I don't want you to get discouraged if you suspect or if we already know that you have an autoimmune disease. I don't want you to be discouraged by this talk of, hey, this is a permanent and it's a progressive problem, because we need to focus on things that we can do, and then we're obligated to go ahead and actually do those things. Now, there are many autoimmune diseases, and we'll talk statistics in just a moment, but the two top ones here on my list are Hashimoto's hypothyroidism, Graves' disease, which is an autoimmune hyperthyroidism, but other common ones that you might recognize would be rheumatoid arthritis. That's where the immune system attacks and destroys the cartilage in your joints. Your joints get red, they get hot, they get swollen, they get large. For example, your hands, your fingers may get angulated because as you lose the cartilage in your joints, it changes the orientation of one part of the joint versus another. Multiple sclerosis is autoimmunity of the brain. Celiac disease, type 1 diabetes, and even these days, Alzheimer's and Parkinson's disease are being talked about in the medical literature, is that there is probably an autoimmune component to these. And we've known for a while that ulcerative colitis and Crohn's disease are associated with that as well. According to the Autoimmune Association and Related Diseases, there are approximately 50 million people in the U.S. with known autoimmune diseases. And this is really profound, because when you look at statistics for things like cancer and heart disease, there are way many people walking around with autoimmune issues, of which Hashimoto's is one of the more common ones, but there's way more people walking around with autoimmune issues than either cancer or heart disease, and in fact, even both of those combined. Now, it doesn't mean we ignore cancer and heart disease, but the question is, should we be focusing on people with autoimmunity? And the answer is yes, but here's a fundamental problem. In the conventional medical system, there is no specialist that is trained to deal with autoimmune disease. Now, you might think, well, no, that's not true, because we have immunologists and we have rheumatologists. Well, hold on for a second, because those doctors are not trained in autoimmune disease management. They may manage people with autoimmunity, but that doesn't mean that they actually manage the immune dysfunction of people with autoimmune disease. And so whether you're looking on the conventional side of medicine or the alternative side of medicine, there are no specialists in autoimmune disease, which is why people with autoimmune disease often fall through the cracks and get left out in the cold. They get mismanaged, and they spend many years, if not the majority of their life, suffering and getting worse because no one knows how to recognize and manage the problem. Now, as of right now, we know of about 100, the estimates are between 80 and 100 different autoimmune diseases, and there are 40 more diseases on the table that are suspected of having an autoimmune basis. And I mentioned just a moment ago, things like Alzheimer's disease and Parkinsonism are now gathering some data and research behind them, saying that there is probably an autoimmune process, at least in some aspects or some cases of those things. Now, can you have Alzheimer's disease that's not related to an autoimmunity? Yes. Here's a scary thought. Young boys playing football in, say, not the Pee Wee League, but, playing football at a very young age, constantly hitting their head, they are showing signs of the changes in their brain consistent with Alzheimer's at the ages of 10, 11, and 12 years old. Now, that's a traumatic inflammatory induced problem, not necessarily an autoimmunity. So some problems with autoimmune related disorders are related to autoimmunity, some may not. There could be some other mechanisms. So let's talk about 3 different stages of progression of autoimmunity. If we understand that autoimmunity is a confusion, it's a loss of distinction within the immune system between self and non-self, we want to talk about how this progresses over time, because we've said it's permanent and we said it has progressed. Well, if you dive into the literature and you start putting little pieces of data from one research group to another, if you put them together in a big picture, one thing becomes very clear, is that autoimmunity does develop in a progression. Now, so for some people, they progress through these different stages very, very quickly. For others, it may take decades to go from stage 1 to stage 3. But let me explain what these 3 different stages are. The first stage of autoimmune development is what we call silent autoimmunity. And this is where you have antibodies to a tissue. And we'll talk about the thyroid here. You have thyroid antibodies. We'll clarify what those are in just a moment. But despite the fact that you have an antibody against your tissue, you have no symptoms, and all the labs related to your thyroid are perfectly normal. So your TSH is normal, your T4 is normal, your T3 is normal, right? We have antibodies, but nothing else. That is the earliest stage of progression, right? That's where the immune system initially gets confused and then starts attacking it. Now, the reason why there are no symptoms is because when you start out attacking your own body, you have more cells than you need to maintain normal function. So you can lose a few cells that make your T4 and your T3 hormones, and you still don't suffer because you have enough other healthy cells to continue making enough hormones to stimulate your cells to create those proteomic responses. But at some point, as the immune system continues to attack your thyroid, you start to lose more cells, and all of a sudden now you start to compromise your total thyroid hormone production capacity. And so there's going to be a threshold where you've lost enough cells that now you're going to start to become symptomatic. And this is what we call stage 2 or autoimmune reactivity. Now, this is not the formal disease. That's the third stage, and that's where the conventional system is really focused. But with autoimmune reactivity in stage 2, of course, we still have antibodies to the thyroid, but at this point, we have lost enough thyroid integrity that now we become symptomatic. Now, we haven't lost enough integrity to shift our lab values, meaning in this stage, you're going to have symptoms, you're going to be miserable, but your TSH is normal, your T4, your T3 are normal, all of your thyroid markers. And this is a big problem here because in the conventional mindset, they don't really care about what's going on until you get into the third stage where they can identify hypothyroidism based on their lab values. People who are in stage 2 suffer with multiple symptoms in multiple systems because remember, the thyroid's involved in everything. And as the thyroid loses its ability to match production with demand in the cells of the tissues, you become symptomatic, and usually you have more than one. It's like fatigue and weight gain and poor sleep and cold intolerance and my gut doesn't work and I'm depressed and I'm anxious and I have brain fog. That's kind of your classic thyroid picture. And quite honestly, the medical community, in the absence of a well-defined hypothyroid picture, doesn't know what to do with that person. Right? Again, it's a very huge problem. Now, as you continue to progress and lose more and more thyroid function, let's make an assumption that nothing is being done to control the immune system, right? So we still get this confusion principle. We still get attacking and destruction of the thyroid. We continue to lose hormone production capacity. Well, eventually things get bad enough that not only do you have antibodies in the third stage, which is the full-blown hypothyroid disease state, you have antibodies, your symptoms are getting progressively worse and including more things, and now your labs are normal. And the classic diagnostic criteria would be that you have a high TSH value. And what that means, if you go back and remember how the thyroid system works, your TSH level goes in the opposite direction of your T4. And the T4 is what comes out of your thyroid gland that gets converted to T3 to work on making your cells active and healthy. So if your T4 production goes down because you're destroying the cells that make it, then the natural intelligence of the body, now rooted up in the brain, is going to say, well, I don't have enough thyroid hormones out there. I better kick up production. And that's where your TSH goes up, because that's a signal from the brain to tell the thyroid gland to make more thyroid hormones. So this 3-stage progression is pretty consistent, but again, everyone's version of this is going to be different. Some people will scream from stage 1, 2, and 3 very, very quickly. Others will go very slowly. And quite honestly, we do suspect that people might get stuck in stage 2 and stay there and be miserable for very long periods of time without ever really getting to the point where they have full-blown stage 3 hypothyroidism. So let me make a couple of other comments here. In stage 1, having antibodies but nothing else is what the medical immunological literature is calling predictive antibodies. So there actually is predictive value. There's 2 reasons to run an antibody test for any system. One is to diagnose what's going on today, and the other one is to look at what might happen down the road if you don't take care of things. So someone who has antibodies to a system, but they have no symptoms and all their labs related to that symptom are normal, they're getting a peek at what might be happening down the road, right? So there's a predictive value in that. The second stage Again, not recognized by conventional medicine. And this is where people get the referral runaround, right? So people come in and they have all these symptoms going on related to the thyroid, even though it's not recognized that way. So they get referred to the gastroenterologist for their gut problems. They get referred to maybe an endocrinologist for some hormonal issues. They get referred to an orthopedist or a rheumatologist for their joint pain. And you know, understand what I'm saying. So the referral runaround is happening because there's a mismatch between what the system is geared to recognize and how it works. There's a mismatch between that and what actually is the nature of the problem. And it goes back to this concept that there are no autoimmunologists. There are immunologists, but there are no autoimmunologists. And then finally, in the stage 3, when you actually have the full-blown hypothyroid condition that's identifiable by standard lab patterns, the conventional focus is not only just here, but the focus is on the tissue itself. It's focused on replacing the hormones that have been lost, but there's no real treatment for the problem, which is immune dysfunction and immune dysregulation. And that's a real important thing for you to recognize, especially if you do have this or we suspect that you do. Thyroid hormone replacement is often absolutely necessary, as we described in our last session. But all it does is it replaces what's being lost. It doesn't change the problem, which is the immune dysregulation and confusion itself. Now, the thyroid gland, of course, is the target, right? Even though we don't treat the tissue that's being targeted, we have to have a fundamental understanding of what's happening. So what happens when the thyroid is targeted by the immune system is that your immune system produces antibodies that mislabel your thyroid as something that shouldn't be there. It's being labeled as if it was a bacteria or a virus. And these antibodies initiate an immune attack. What the antibodies do is they actually identify to the rest of the immune system, hey, this guy doesn't belong here, let's go get him, right? So there's a label, there's a flag. It's kind of like going to a meeting and they have you sign in and you put your name on a hello, my name is sticker. So hello, my name is Doc. And I stick that on my shirt and I walk around and everyone goes, oh, there's Doc. Well, imagine if the label says, I don't belong here, kick me out. And that's what these antibodies do. And there are different kinds of antibodies and there are different antibody targets even within the same system. We'll talk about here just in a moment. But once the antibodies mislabel your thyroid as something that doesn't belong and they initiate that immune attack, depending on other factors related to the immune system, and related to things that affect the immune system, your rate of attack on your tissue can be very, very aggressive, or it can be calm and relaxed. But once you have antibodies to your tissue that we can recognize, we know that your system is being attacked, right? But here's one thing, and I don't have a slide on this, but this is something that I think is important. We typically go through this in our one-on-one sessions. When we know that you have an autoimmunity, we define that by measuring antibodies to specific tissues. And with Hashimoto's, the two targets are this enzyme called thyroid peroxidase or a protein called thyroglobulin, and you can have both. But once we know that you have an autoimmunity, repeatedly measuring your antibody levels tells us nothing. Because we have many people who have really high antibodies, who have a very calm immune system, and they're not aggressively losing ground. But we have other people who have very low levels of antibodies. They're still elevated, but quite a bit lower than, say, someone who's got high antibody levels. But that person with the lower antibody levels can have a very aggressive immune response, and they could be losing ground. So I don't want you to get fixated on your antibody number. In fact, once we know you have antibodies to your tissue, I don't measure those again, because how aggressive your immune system is predicated on other things. We'll explore that idea more when we get into more detail in another series on autoimmunity that's not geared towards a specific tissue or a specific target. Now let's return to the thyroid. The targets with Hashimoto's disease are this enzyme called thyroid peroxidase, it's abbreviated TPO, and another one called thyroglobulin, it's abbreviated TBG, or sometimes it's called anti-thyroglobulin antibodies, or ATA. There's different names depending on what the labs prefer. So what are the differences? Well, the TPO is the most common target. And it is an enzyme that's used to make your T4 and your T3 hormones. I'll show you a graphic just to reorient you. We're going to dive into one of these cells in the thyroid called a follicular cell. I'll show you where these things exist. So your TPO is the enzyme used to make T4 and T3. It is the most common target. Thyroid binding globulin is a protein that's used in the manufacturing process. So at the end of the day, whether you're attacking your TPO or your TBG or both, you are doing something to diminish T4 and T3 production capacity, either by destroying the enzyme used to make it or the protein structure used to assemble it. It's kind of like destroying a machine in a manufacturing plant that is used to make, say, a widget or whatever it is that plant actually makes. So when we look at these antibodies, testing for Hashimoto's has to include both, because any given version of Hashimoto's can have antibodies to one or the other or both of them. And sometimes we have to test more than once, because as the immune system gets turned on and turned off, it might be more aggressive on one day, 1 week, or 1 month, less aggressive on another one. We may test just at a time where the immune system's pretty calm. So we're used to seeing clients that have antibody levels that vary. Remember, we said that that's not really an indicator of how bad your Hashimoto's disease is. But we do know that for some people with Hashimoto's, with autoimmunity, we actually have a scenario, and again, we'll go through this in more detail in the autoimmune series. For some people, their antibody levels are diminished because of the dysfunction within the immune system. So sometimes you have to test these things more than once, but there is a percentage of people with Hashimoto's that actually never show the antibodies. And this is published in the literature, and there are some other tricks, so to speak, to figure this out. So one would be to perhaps run an ultrasound on the thyroid. There are some characteristic changes that we can see on an ultrasound test with Hashimoto's. Like, you may see some inflammation, may see some nodules, may see some goiter formation. So the antibodies are not the end-all be-all, especially knowing that the immune dysfunction sometimes obscures the ability to make the very antibodies that would diagnose the condition. And the problem is, if somebody has Hashimoto's but they're not expressing the antibodies that will tell us, is that these people never get diagnosed and they never get managed from the immune perspective. And that's really where the clinical focus has to be, on the immune system rather than on the target tissue itself. So continuing on now, thinking about the autoimmunity and the thyroid as a target, if you go back to what we talked about before in the first series, we talked about 3 different problems or 3 different types of errors, right? And this is a slide that we used on our prior session. So we said that there were errors in production, there are errors in processing, and that has to do with converting T4 to T3, mostly in the liver. And we also said that there were errors in proteomics or in protein production, and that's what happens as a result of binding to your DNA. But Hashimoto's disease is a problem where we have an error in production because the immune system is attacking the thyroid peroxidase or the TBG that exists inside these little follicular cells. So the thyroid gland is made up of different kinds of tissue, different kinds of cells, but there is one kind of cell that is called a follicular cell. Now, let me reorient you again. We saw this in the last session. So on the left-hand side, we have the brain talking to the thyroid gland, and then out of the thyroid gland, we have T4 and T3. Then that gets out into the bloodstream in the protein-bound form. Inside the liver, as the bloodstream and the hormones are going through the liver, there are enzymes that convert it into either active T3, the inactive T3 that can be reconverted, or into the reverse T3 that never comes back. But here's the difference in terms of where these things happen. Production, processing, and proteomics. And Hashimoto's is a problem within the thyroid gland itself in the production process that ends up with T4 and T3 production. So let's zoom into a follicular cell now, and let's take a look at where this stuff happens. So this is a graphic, and I pull this down from Wikipedia. Wikipedia actually has a fairly decent article, not just on thyroid hormones and T4 and T3 and thyroid peroxidase and Hashimoto's, you might want to go there and just do some basic reading. Remember that it is a very, very simplified version of what actually is happening. But this is a blown up image, blown up image of a follicular cell. And so the follicular cell is this right here. Out on the right-hand side, we have the bloodstream. So I'm just going to go through this as kind of a sequential thing. So when your pituitary releases TSH and TSH binds to the TSH receptor on your thyroid gland, what it does is it causes the thyroid gland to take up something called iodide, and iodide comes inside the follicular cell, and it gets basically ported to the interior, just inside where the follicular cell is, into something that's called the colloid. Now, these names don't really matter all that much. I just want you to get an image in your mind of how this works. So the TSH comes down, stimulates the thyroid gland, your thyroid sucks up some iodide, and then in addition to that, the follicular cell makes this protein called thyroglobulin. And thyroglobulin also gets transported into the colloid area, and this is where the manufacturing actually happens, right? So we have this thyroglobulin protein up here, and this is kind of like it's like a framework. It's like a framework that you hang stuff on to make it. Like imagine that you're working in a shop and you need to hang something up so you can work on it. That's what the thyroglobulin molecule is. And what happens is the thyroglobulin molecule serves as the framework, and then all of a sudden, as the iodide comes in, the thyroid peroxidase then takes the iodide and converts it through a process called oxidation into iodine. And by taking the iodine and hanging it onto different places on the thyroglobulin molecule, so we get thyroglobulin, we have iodine, and those combine to actually make your T4 and your T3 hormones that then get re-imported back into the follicular cell, and then it gets chopped up into T4 and T3. So T4 is thyroxine, T3 is triiodothyronine, and then your T4 and your T3 gets exported into the bloodstream, right? But remember, what's happening with Hashimoto's disease is that as your TSH is stimulating this process of production, the immune system is destroying either the framework upon which you make your thyroid hormones, or it's destroying the enzyme that's involved in oxidizing iodide to iodine so that you can hang things on the thyroglobulin framework, or you may have both of those being affected or destroyed. And unfortunately, as we said just a moment ago, for some people with Hashimoto's, their ability, because of the dysfunction within the immune system, their ability to show us the antibodies against these tissues is compromised. But nevertheless, we end up with destruction of these particular elements. Now, there is one more factor here, is that as the immune system attacks and destroys one or both of these proteins, the immune system tends to flood in, and you actually get a whole bunch of white blood cells coming inside these follicular cells. And what this reminds me of is back in, say, the 1960s and 70s, it was kind of common for college kids to see how many they could fit into a phone booth. And depending on how old or young you are, you might think, well, what's a phone booth? But back in the 60s and 70s, phone booths were common, as were VW Beetles, the original versions. And so, they could try to fit as many kids into the VW Beetle or into a phone booth. Now imagine if you had a scenario where if you added one more kid into a phone booth or a VW Beetle, that the vehicle or the phone booth would actually explode because you put too much stuff in there. And that's what happens with these follicular cells. As the immune system is attacking these protein structures, the white blood cells cram inside the follicular cell, but at some point, because this is a flexible living structure, you get one too many white blood cells and the follicular cell actually dies. It explodes. And so not only do we see destruction of the elements of thyroglobulin or thyroid peroxidase or both, we actually over time see the destruction of the follicular cells that are responsible for initiating and controlling the process of making these hormones. What's the end result? Well, you make less hormones, right? You have impaired ability to do the manufacturing process. You destroy the manufacturing plant, so to speak, as the follicular cells die. But over time, you make less and less and less. And that's an absolute limitation. It's not, some days are better than others. When you lose these cells, you don't necessarily replace them. And this is where the degree of permanency with some of these autoimmune issues come from. Now, with the thyroid as a target, we said the Hashimoto's disease is an error in production because we get antibodies to and destruction of key elements of T4 and T3 production, including destroying the follicular cells themselves, so that for any given level of TSH output from the pituitary gland, you're going to make less T4 and less T3 hormones. And this is why, because of this inverse relationship, as your T4 levels go down, your TSH levels go up. So for everyone with the Hashimoto's process, there is a critical threshold where you just don't have enough cells and capacity to make T4, and your pituitary says, I need to try to get more production, so it makes more and more TSH. So TSH goes up, which is the diagnostic criteria that you've reached that third stage, that third phase. Right? But it's that inverse relationship. For any given level of T4, you make any given level of TSH, you make less T4 and less T3 because you're destroying production capacity. So ultimately, what's the clinical focus? Well, the clinical focus has got to be defined by the nature of the problem. Like, autoimmune thyroid disorders are not thyroid problems. They are because that's where the immediate symptomatology and lack of proteomic responses come from. But in reality, autoimmune thyroid disorders are immune dysfunctions. And so effective management of Hashimoto's disease is not gland-based. We might support the gland. And from a conventional standpoint, they want to replace what the gland's not making, right, with thyroid hormones. But effective management from a physiology-driven or a systems-driven perspective has got to be focused on immune balance and immune control, which means that we have to identify and remove or manage all things that are driving immune dysfunction. So if the issue is immune dysregulation, and that leads into diminished T4 and T3 capacity, lower proteomic responses at the cellular level, and as a result, the broad spectrum of thyroid symptoms, you can imagine that if your treatment and focus is over here, let's control the symptoms and let's give you what you're not making, that's great. But at some point, even that will fail because you're not doing anything with the problem to begin with. And as you're replacing hormones and trying to control symptoms and referring people around for all the different things that the thyroid dysfunction is relating or producing, in the meantime, your immune system's still in the background chipping away, destroying thyroid cells, destroying your TBG, destroying your TPO, and all of a sudden the hormones you were taking before are not enough, and you need to take more, so your dosage goes up. Or maybe sometimes you need more and sometimes you need less because at some point your immune system surges and you get a real aggressive response and then it pulls back. And so depending on how aggressive and how far your immune system is waxing and waning, you may be on higher doses for a while and that works, but then all of a sudden you get jittery and nervous and anxious and hot sweats, and now you're high thyroid, and then your doc says, well, we need to pull you back. And so they pull you back, and then your immune system calms down, and now there's not enough thyroid based on your immune system being kind of more calm, and all of a sudden you need more thyroid medications again, right? These are the classic presentations of Hashimoto's disease, is where you need increasing levels of hormones over time, and that's because you're losing ground, or you need more meds, you need less meds. You need more meds or you need less meds. Or a third one is that you need meds, but you take meds and it doesn't really make any difference. And that's because there's a significant immune dysfunction or inflammatory response that's even obliviating the med's ability to produce symptom control. Right, so the clinical focus has got to be placed squarely on the nature of the problem, which is the immune dysregulation. Now we're going to bring this session to a close, and I want you to realize that there's no way that I can relate to you all of the details of managing thyroid autoimmunity just in a 20, 30, or even 60-minute video like this. One of the seminars that we teach in the lecture circuit that I'm part of is a 3-day seminar called Mastering the Thyroid. And in fact, the content of that seminar called Mastering the Thyroid is is basically the source material for this book that you're seeing here on the screen. Why do I still have thyroid symptoms when my lab tests are normal? Now, maybe you don't have normal lab tests, and maybe you haven't been formally diagnosed with Hashimoto's disease. Maybe we suspect that's what the issue is. Nevertheless, you need to have this book, and you may have it already. If you don't, if you've not read it before, if you don't have it, please let me know, and I will make sure that you get a copy of it, because this will go into a lot more detail about the thyroid system and autoimmunity than what I can relay to you in just a couple of little videos like this. So this book is a kind of a consumer-friendly version of the material that we teach doctors in our 3-day Mastering the Thyroid seminar. Now, as of when I'm recording this particular video, they are working on an updated version of this, because as you can imagine, things change in the world of medicine, and including natural medicine, because as every year, every 6 months go by, there's new research, we learn different things, and we get better at managing stuff. So there are some things in the original versions of this book that we're doing differently. So if you read the book and it seems to contradict something that we've talked about, or maybe there's something in there that we're not doing, I don't want you to be confused. Please ask me about it. But I don't want you to consider this to be the Bible or the playbook, if you will, meaning that we can't take everyone and just do the same thing. We have to be a little smarter, and that's the whole concept behind unique wellness, is that it's about you. Nevertheless, this is the best resource that I can point you towards and make available to you to make sure that you have the data and the information that you need. Now, I know that we've kind of talked about quite a bit, so feel free to go back and listen to this video again. Let's make sure that we clarify any questions that you have in your one-on-one sessions, and then we'll be talking more about autoimmunity and the general approach to managing that in an upcoming lesson. Take care.